Good day to all. I'm Dr. Prenolan Pillay, a specialist physician in private practice. I'm making this broadcast on Stroke Day from MooiMed Private Hospital in Potchefstroom. So I'm going to be talking to the public about stroke. Okay, stroke is one of the major causes of morbidity and mortality in most patients above 50 worldwide. It is of utmost importance for us to recognize this as early as possible and institute the necessary measures. Okay, so what is a stroke? So simply put, a stroke is a brain attack. Okay, it's an acute onset of focal neurological deficit affecting your central nervous system. Okay, that is of vascular in origin. Simply put, it's an event that occurs immediately or over seconds to minutes, affecting your brain and central nervous system, and it involves your blood vessels. Okay, so most strokes in South Africa are what we say ischemic or involving a blood clot in nature. Okay, this comprises around 87% of strokes. The other type of strokes are hemorrhagic strokes, where you get what's called an intracerebral bleed, which is a bleed in your head, or a subarachnoid hemorrhage, which comprises 13%. Okay, basic risk factors for stroke are hypertension, diabetes, high cholesterol, sedentary lifestyle, excessive smoking, consuming alcohol, okay, coagulant conditions such as protein C or protein S deficiency, okay, polycythemia, certain types of cancers, certain drugs like your oral contraceptive pills, cocaine, ecstasy. Okay, so basically it's crucial for the public to recognize this early. Okay, and there's a score which we use. It's called the Cincinnati Pre-Hospital Score, which it incorporates a mnemonic called FAST, F-A-S-T. So for the general public, what this means is that FAST, if someone develops any form of facial asymmetry, or if the mouth droops to one side, or any weakness of the face. The A stands for if there's arm weakness. So basically, if a patient has weakness on one side of the body, okay, and the S is a slurred speech. Okay, so if one of these symptoms are present, there's the probability of a stroke is 72%. And if three of them are present, the probability of a stroke is 84%. It is of utmost importance that the general public is aware of this and notifies the EMS, the emergency medical services, as soon as possible, so the necessary stroke chain can be put into place and put into action. Okay, so basically how we manage a stroke, it depends on what the cause is. Okay, so basically if it is what we call an ischemic stroke, ideally we want the stroke to be recognized as soon as possible, the necessary measures instituted as soon as possible, the EMS services upon picking up the patient, notifying the hospital, so the stroke team is going to be available. So we have certain guidelines and certain rules that we apply to. So ideally when a patient presents to hospital, we want the patient to be examined, a full neurological examination within 10 minutes, a CT scan done within 25 minutes and correctly interpreted within 45 minutes. And if it is stroke because of a blood clot, which we call an ischemic stroke, then we need to institute treatment such as a clot buster. Example of such is a drug called alteplase. Obviously, we first have to make sure there's no contraindications or reasons for us not to use this. Okay, such as if the patient has a bleeding problem, or if the patient had a previous bleed in the head, or if the patient has a neoplasm, the patient has undergone any surgeries in the last 14 days, the patient has any bleeding from the gastrointestinal tract or genitourinary tract, if the patient has any evidence of an active peptic ulcer, if the patient is pregnant, the patient is less than 18 or more than 80. In such circumstances, we would not institute a clot buster. Okay? So if the patient presents to you outside of 4.5 hours, is not eligible for the clot buster, then we institute medical treatment. So we give the patient blood thinners such as aspirin. We give them, we optimize their blood pressure, their blood glucose. We start them on a statin to control their cholesterol. Okay, and depending on the disability caused by the stroke, the stroke team, the stroke panel comes into play, where we collaborate with physiotherapy, we collaborate with occupational therapy, with a speech therapist, to assess if the patient is able to swallow. If not, the patient is at risk of aspiration, and we might need to consult a general surgeon to put in a PEG tube, a feeding tube. Okay, so we also watch out for other complications of a stroke, such as a blood clot in your leg, a blood clot in your lung. Okay, we also mobilize the patient to prevent bed sores. We provide the patient with adequate hydration fluids to prevent dehydration, and we monitor for infections such as bladder infections and also chest infections. So the most important message that I would like to convey from this talk is that me as a specialist physician, my role is not only to provide medical treatment, but it's to empower the public with the pillars to recognize features of a stroke. If you come across any of a friend or family member with facial asymmetry, or your mouth drooping to one side, or weakness of your face or your eye, or weakness of one side of the body, of your arm or your leg, or a sudden loss of vision in your eye, sudden loss of balance, where you have balance problems or dizziness, I would recommend that you guys, as it's of utmost importance that you guys contact the EMS as soon as possible, so we could get you guys to the hospital as soon as possible, institute the necessary measures, and if the stroke is because of a blood clot, and if you fall within the criteria of the 4.5 hours, we would like to institute a clot buster. I thank you guys.